Dr. Michael Ryan with Missouri Vein Care, discussing what are some tips for wearing compression stockings. Well, compression stockings are one of the least popular things for many people who have a vein condition. There is a minority of people who swear by them because they bring such tremendous relief and they will not go a day without them. They know how much they help them. But most people, it is a struggle and it is difficult to put them on. There's a couple things that can help. One is that you can wear a thin sock just above your ankle, and that allows the compression stocking to slip over your ankle. The ankle and foot are the most difficult parts of your leg and foot to get the stocking over. So once you get past the ankle and foot, the stocking is a lot easier to pull up onto your leg. So that's one tip. Another is you don't want to put your stockings on right after a shower. You want to make sure if you are putting them on in the morning, your leg is completely dry, and you can use a little bit of powder. A little bit of powder will help the stocking slip right over. Another tip is for people that have difficulty or weak hands. Some people that have arthritis or other conditions, it's difficult to grip the stocking. You can wear gloves. You can use either kind of exam gloves that you can get, thin rubberized gloves, or you can get the gloves that you use to clean your kitchen. Those will allow you to really grip the stocking and pull it up if you're having trouble grabbing onto them. The other big question is, should I use knee high or thigh high? I tell people if they can, if the knee high stockings work for them, then that's the easiest solution, because you really only have to go over one joint, which is the ankle joint, and you don't have to pull the stocking up over your knee. Some people find that it's not comfortable. I would say that's the minority. So most people do just fine with knee-high stockings. So other tips that are important to consider is really the stockings work best if you put them on first thing in the morning and take them off just before you go to bed at night. So that's really important. The other is if the stockings are bunching up and forming a little band in your calf or thigh, that can be very uncomfortable, and that is something that you really want to just pull it up. And for some people, the stockings that they're using, the thigh high variety, is beginning to slip down, and there is a product called stocking glue. It actually is much more user friendly than it sounds, and it's a kind of an oil that you put on your skin, and for whatever reason, some of the stockings that have a rubberized band to the top will really kind of stick to that and it won't slide down. Another important concept is that you have to get the right size matching your leg dimensions, and there are guidelines for measurements, and that you have to measure the ankle, the mid calf, and the knee, and then the length of your leg. So you want to make sure you have the right size. If it's too small, they will be exquisitely painful, and in fact can cause a lot of nerve irritation and nerve numbness, and so you want to make sure you get the right size. So this is Dr. Michael Ryan with Missouri Vein Care, giving you some tips on wearing compression stockings.